Hello everyone, Homeopathy Heals again welcomes you. Myself, Dr. Anam Zahir, and today, 8th of August, Sunday, we are here with episode 25 of Instagram Live Guest Talk with Homeopathy Heals. Just let me know if I am audible to everyone. Okay, so we have a very different topic today. We'll be discussing about, we have a cardiology topic today, and we'll be discussing about congestive heart diseases, the scope of homeopathy, when to take a case, when to refer a case. Being a homeopath, how can we help patients suffering from cardiac disorders? And I think it's need of the hour because हम में से बहुत सारे ऐसे होम्योपैथ्स हैं, even myself, when I get an ECG, when I get a 2D echo and I look at the patient, I usually refer them to the cardiologist, है ना? We don't want to take a risk because we don't know our the scope of homeopathy in treating cardiac disorders, but we must know the limitations as well. So I hope this session will be an eye opener before we take or not take any cardiac case. Okay, let's try to add our guest. Hello all, very good noon to you all. Hello Tejas. Sir, if you can see this live video, please send the request. Hello Mohammad Azim, very good afternoon Homeo Addict. Instagram need to fix this. Very good noon. Let's wait for sir to come. There's a question, do you have treatment for corona? Is it true? Yes, homeopathy treats according to the totality of the symptoms, as the remedy. I have myself treated so many COVID patients, but I don't ask them or I don't advise them, don't take any modern medicine or any medicine given by other physician. They can take homeopathy along with the medicine they are taking. And we have got really very good results, not in just corona, but the post-COVID complications, the post-COVID vaccination complications. We'll discuss about it. Dr. Dhruv will discuss about my experience in serious cases. Honestly, if I tell you about my experience in cardiovascular cases, uh, whatever cases comes to us being a homeopath, either they are mostly surgical cases or terminal cases, I must say, okay, very old patients. So I have palliated them, and I have treated a few Kawasaki diseases in kids, and I have got wonderful results. I'll be sharing you the remedy which I used. I had 2 cases of Kawasaki in past 2 years, and one Kawasaki disease was post COVID. So definitely I'll be sharing you, and now the 2D echo is completely fine, completely normal. So such cases, if CT score is 25/25, so does homeopathy can treat that inflammation in lungs? Of course homeopathy can treat. We have homeopathy treats severe to severe cases of pneumonia. Even the lungs is full of mucus, patient is not able to breathe. I've seen homeopathy works wonder. I mean, just tagging it as a COVID pneumonia, and patient gets panic, doctor gets panic. It's not at all like that. Treat each and every case as a different one. Take the symptoms, give the medicine, make sure that your dosage, your potency and your repetitions are adequate. Is ASD and VSD is curable? Actually, ASD and VSD are self-limiting. By the first birthday, they are they get cured on their own. Sir, if you can see us, please send a request to be here in live video. And if it remains after 3 years and 5 years, it becomes a surgical condition. Once lungs, they come into fibrotic condition. Once the fibrosis is there only we can help is the palliation. But yes, homeopathy can help. It can cut short the journey of the disease. It can save from so many complications. It can reduce the amount of time a patient spends in ICU or hospital admission. Bhuvan Kumar is asking how to read Allen's keynote for PG preparation. See, I'll tell you, Allen keynote is very, very important. Not in just PG, UPSC also, you'll get the exact symptom or from the Allen keynote as a question. But to understand Allen keynote, we should know about the materia medica. Allen keynote is just like a glass of juice from 2 kg oranges. So you need to know about those 2 kg oranges before you extract a glass of juice. So a very deeper knowledge, because each and every word, if you read Nux Vomica from Allen keynote, in just first paragraph they have described Nux Vomica in different words, and each and every word has its own meaning. So if you start elaborating any drug from Allen keynote, it will require 25-26 pages, I guess. Polycrest remedies. And never ever also take care of all the comparative medicines is given in Allen keynote. This I like so much about Allen keynote. For example, if there is a symptom, if there is fear of downward motion in the borax, so the remedy is given in the comparison. You need to learn them by heart as well. Sir, can you see us? Yeah, I'll tell you. In one Kawasaki disease, I gave phosphorus. Phosphorus I gave in 200 potency, and I repeated it in a month. Okay, and I'll tell you, I used some rare remedies as well in those cases later. Good afternoon, ma'am. Tell us about the scholarship test for CCRH. Your college will send you, if you have a good dissertation synopsis, your college will select you and you will represent your state from that. So I think every year 8 or 10 dissertations are selected across the country to present into CCRH. Your paper will be published. If you win, you'll get a cash prize, certificate, and you get a chance to read your paper in front of all the peoples, and your paper will be published into journals. Sir, if you are seeing this live video, please send a request to be in this live video. In chronic cases, constitutional symptom like thirst, sleep, appetite remain as it is before, then we should consider in totality. Of course, what is true for a part is true for a whole. ओके और जो भी एपेटाइट थर्स्ट है वो किसी और की नहीं है, वो उसी पेशेंट की है टू whom you are treating. If it's not changed, that's okay. What we take changes, we mostly take changes in acutes. Patient is thirstless, पानी पीता ही नहीं है, but as soon as he falls sick, he is having fever, she is having fever, she started drinking ample amount of water, gallons of water she is drinking, है ना? So this becomes the peculiarity. So whatever the thirst it is, whatever the appetite it is, we take it because it depicts person as a whole. And general T's, I told you again and again in each and every session that physical generals have their own importance. I cannot name any medicine, okay, fatty liver hai medicine. You just take an appointment from any homeopath, a good homeopath near you, give the case and get the medicine. I don't know why I'm getting Sir's text in the inbox, but I'm not able to join him. Dr. Nilesh Yadav is asking, should we use mother tinctures in cardiac disease? Yes, absolutely. And today's session is all about the, more about what mother tinctures, we'll learn about what mother tinctures we use or Sir have used in his practice in cardiac cases. Ma'am, if patient has an acute MI, can we manage case with homeopathically? Yes. But it doesn't mean that you keep patient with you. Refer the patient for further investigation. Any idea or practical use about moon phase of remedy? Yes. Yes. Although I don't have that much patient that I wait to prescribe Cilicia to the new moon and the full moon. But the practitioners, those who wait for the time and moon phases to give the medicine, they get excellent results. I'm not able to find him. I gave aspidosperma Q to a patient for a saturation maintenance, but it didn't work in COVID. There is no hit and run rule that you give aspidosperma and you expect that aspidosperma will definitely work. You might have go with the totality. There are so many other drugs which helped me in getting this SpO2, Carboveg, Camphora, and Palmoval. And I have even used arsenic album also. I hope Sir will be here any minute. If you have more questions, you can drop them. There is a remedy which is named as Adonis vernalis. it's an also very good heart remedy. Somebody has asked me about that. And when heart conditions, they are related to rheumatism and influenza. When there is fatty degeneration of heart, and when there is more contraction of the heart, and with this contraction of the heart there is a lot of urinary secretions. So we think about adenolis vernalis. Patient is pulse is very weak, but there is a palpitations, increased secretion of urine, and patient is saying the ailments are from getting influenza. So it can also be used in post-COVID cases when there are cardiac complaints. So adenolis can be thought about. But if the patient isn't able to tell his or her symptom, if patient is on ventilator, how you take the symptoms and give the medicine? Yeah, but my question here is the hospital is allowing you to give homeopathic medicine to a patient who is on ventilator? Number one, because I found it very much difficult in a few of the cases where the patient's bystanders, relatives wants to give homeopathic medicine, but the doctor and hospital didn't allow. Even if patient is on ventilator, there is a lot many things. There is previous history, there is physician's observation. So definitely you'll get something in a case, something or the other you'll get in a case. You even know the journey of disease, how the disease occurs, whether it was sudden or it was very gradual. So definitely it will help you to select more closer simillimum. Recurrency of bile stones causes sick to the patient. So what probable remedies? So there are so many remedies, I'll tell you. If there is a lot of pain due to gallstone, colic, chelidonium, colestrinum is a sarcode, it acts very good. And feltaury is a remedy to be used in lower potencies like 3x, and it helps us in clearing the sludge in the gallbladder. But gallstones, they are 100% curable in homeopathy. I won't say that, because so many patients they require, when it obstructs the lumen, so definitely it requires surgery. Cholecystomy is required. Thank you so much, Dr. Priyanka, for your kind words. You people keep me going on and on. Management of low IVF patients. IVF, LVF. I am not able to find him. And I don't want to end this live. What medicine we should use for perianal abscess? The remedy which comes to my mind is Cilicia. Cilicia has helped me a lot in all those fistula, fissure, perianal abscess cases where there is suppuration. Other remedies like myristica, if there is burning, arsenic album, if it is a tendency and you need to break the tendency, sulfur. There are so many remedies, as the symptoms as the remedy. Treatment of glaucoma, honestly I have not treated any cases of glaucoma clinically, and I don't feel like teaching here this remedy for glaucoma, this, unless I don't get results. There's no point in saying that there is a treatment for glaucoma. And I think cataract is completely a surgical condition, although we have rubrics in Kent repertory for the cataract, but I have not seen that cataract is curable. My aunt is having a gallstone of size 2 mm, so could homeopathy treat it? Unless and until your aunt's LFT, liver function test, is normal, it's not obstructing, there is no obvious signs of jaundice, there is no pain, it's okay to manage the case with homeopathy. And the diet plays a very important role in cases of gallstones. If it obstructs the lumen, I would suggest you to refer the patient for emergency cholecystomy. Remedy for colic in child, there are many actually. In pediatric cases, observation is everything, because kids, they are not going to tell. 2 days back, I have a kid of 5-year-old. he came with extreme stomach pain, and he was lying on the shoulder of his mother. Okay, and he was like, "Pot dukta hai, pot dukta hai, pot dukta hai." He was not, he was not willing to tell any other symptom. And I cannot force a 5-year-old kid to tell what happened. And parents were in very panic situation. Earlier, when I started my practice, I used to get panic as well, and there's no harm in getting panic for a homeopath or a beginner like me. But he was like, and I was not able to get any symptom. बार बार पोट दुखता है ना, and sleeping, पोट दुखता है. So there were so many remedies that came to my mind. Should I give Macphos? Should I give Colosynth? I closely observed the kid, and he was doing like this. He was, doing retching. I just checked his tongue, and jeep dako. And I took a glass of water and added 4 drops of a medicine and asked him to take sip by sip. He just took 1 sip and he slept. Then he woke up, halka sa pot dukta, another sip, and he slept. He slept for next 6 hours, and he woke up at 4 or 4:30 or 5 p.m. Uske baad he didn't had colic. It's been 3 days. So the remedy given was Nux vomica. Nux vomica I gave in 1 potency, only 2 sips of water. Just because he was having that nausea and retching associated with the colic, I give Nux vomica. If it was just like if he was, I would have given Colosynth or Macphos. So in case of kids, colic or whatever, observation is everything. Okay, I've got so many questions. Finally, very good afternoon,
Hi, good
sir.
afternoon. Could you hear me?
Yeah, loud and
Okay.
clear. I'm so sorry for troubling you. What time is it in
Oh,
Canada?
it's actually you put like 9 p.m. Basically, it is 2 a.m., 2:30 a.m. in the morning. I was also messed up with the timing, but doesn't matter.
Oh
I
my
put
God,
a
is it not 9 p.m. in the
no,
Canada?
it's 3 a.m. in the morning, but no problem. I put an alarm and I woke up.
Oh my God, I'm
No
so
problem.
sorry, sir.
That's
I'm so sorry.
perfectly
Actually,
fine.
I checked on the
Yeah, that's
Google.
perfectly fine. No
I
problem.
checked on the Google,
Okay.
and it showed me that 12 noon is 9 p.m. in the Canada. So I was like, okay, you can
Okay,
have your
yeah.
OPD and
Canada
your
has a lot
hospital,
of
and
time
then
zones. It's in Toronto time. It's like, it's okay, no problem. It doesn't matter. It's not a big
I'm so
deal.
sorry. I'm
No
so sorry.
problem.
So before we should start, let me introduce you. He is none other than Dr. Sanjeev Ampadi. He is MD in homeopathy from India, and he has done his MD from Canada as well. He is DM in cardiology from Canada and FH in cardiology from Canada only. He's working as HOD in cardiology in North American Medical College of Homeopathy, Canada, and he's a former consultant in Atlas Hospital, Muscat, Oman. He has presented more than 20 papers in homeopathy, and how I came to know about him that he practices homeopathy on cardiology cases, which fascinated me like anything. But above all, when I reached out to him, I just sent him a mail for the invitation, and he was so grounded. He sent me his personal number, and he was like, "I cannot, play this mail and mail game. You just call me directly, and we plan it." And we planned it in just a period of 7 days. Thank you so much, sir, for being here against all the odds of time as well.
You're very welcome, and thank you for your nice words. All right. Okay, go ahead.
Okay, we'll not waste even a minute and we'll start.
Okay.
Okay, so my first question is, even if we have kept a topic like
Hmm.
cardiology, but we have kept a topic very narrow down, very specific, congestive heart diseases.
Hmm.
So, what is the relevance of congestive heart diseases?
Um, Basically, cardiac diseases are like is increasing number across the world. Even in Canada, almost like 300,000 Canadians are hospitalized with heart diseases. So there's a huge demand in that area for healthcare professionals. So basically, heart and stroke cost its Canadian economy about like 20 billion every year in physicians costs, hospital services, and other activities, other healthcare activities. So it's very important for especially in Canadian situation, but in India thing is even worse. The statistics is not very accurate in India, but still we can project it like maybe like millions and millions of dollars. India is spending for heart cardiovascular diseases, and the worst thing about India is gradually becoming the coronary capital of the world, because coronary artery diseases is skyrocketing in India. So there are many reasons. Genetic factors are one reason. Even though many of the Indians are lean and thin, that doesn't mean that they are not obese. It's a condition known as thin Indian phenotype. They are thin and lean, but still they are metabolically obese. So that's the reason this coronary artery diseases are skyrocketing among Indians. So we need basically a lot of healthcare workers working on cardiovascular diseases in India, and uh, that's why I would say it has a huge relevance. But there is one more point I have to add on to this cardiology scenario. Cardiac diseases is not a standalone disease. Basically, it's a combination of other diseases like obesity, heart attack, then type 2 diabetes, and fatty liver. So there is a weird combination of all those conditions together. So that's the metabolic syndrome. So we are gradually merging cardiology, diabetology, obesity medicine, and everything into one single platform. That's the metabolic medicine. So I would say we have to more focus on metabolic medicine rather than focusing on a smaller area like cardiology, because gradually the cardiology will be narrowed down to some invasive procedures like putting a stent or like an angioplasty, something like that. All the medical cardiology will be merging into the metabolic medicine. That's how the things are going. So that's why it is very relevant.
My next question is, in India, basically we have so many MDs in homeopathy like Materia Medica, Organon, even pediatric. So my question is, why we need a cardiovascular, studies and their post graduations in homeopathy?
Yeah, that's a good question. We need to have the problem of homeopathic
Professionals.
practitioners, especially MDs in India, is they are focusing 100% on materia medica, organon, and those kind of homeopathic subjects. I would say it should be there, but they lack the basic knowledge on even the cardiac anatomy, cardiac physiology, hemodynamics. Those things they are terribly missing. So without a strong foundation on uh, the basic cardiology, nobody could practice cardiology. Whatever system they are practicing, even they spend like tons of hours in materia medica and organon, no use. If they do not know hemodynamics, it's of no use. So um, even in the MD in homeopathy, there is a big paradigm shift that I could see from the last couple of years. Now everything is on homeopathic topics. They're gradually like cutting out all the other general medical subjects from the homeopathic curriculum. So even it's really good to have a cardiology course. I would say like a postgraduate or something like that. But we have to 100% make sure that they know human anatomy. They know proper human physiology. They know proper cardiac anatomy and physiology. Then start from put the foundation there. From there, start learning. If you design a course like that, that's well and good. But if you design a course in cardiology and homeopathy with some organon foundation on it, it's not going to work, because they're not going to see anything on like the mental symptoms, organon repertory, and just for namesake put homeopathy cardiology is not going to work. So first we should know, as a healthcare professional, the first thing we should know is how human body works. That's the first thing. If you do not know how human body works, no use. So if you do something like that, that would be great.
Very true, very true. My next question is, you tell on your experiences, what is the scope of homeopathy in general cardiology?
Yeah, basically we have a lot of scope in general cardiology because cardiology, every time people think about cardiology in a very limited area, like coronary artery diseases. So cardiologist means heart attack, and then go to a nice intensive coronary care unit, and somebody is checking the thrombolizing the person or putting the person in a catheterization laboratory. That's the thing people always think. It's not that. It's not true. It's a big umbrella. It includes everything like hypertension, starting from hypertension, then high cholesterol, arrhythmias of heart, valvular heart diseases, um, pediatric cardiology. Those are very important. Pediatric cardiology is also important in homeopathy. So these are all the areas where we can play around with. So just not just the coronary artery diseases. These are all come under the scope of homeopathy in cardiology. That's a general cardiology, I would say.
Okay. Sir, please tell about the scope of homeopathy in coronary heart disease.
In coronary heart disease, it's a kind of that's a kind of tricky question because we look into the coronary artery disease. The majority of the issue is coronary artery disease or acute myocardial infarction. So everybody will be thinking that CAD means acute coronary artery, or it's in other ways known as ACS, or acute coronary syndrome, or like MI. MI is myocardial infarction is not, that word is not much popular now. It's known as ACS, acute coronary syndrome. But the question is, what causes acute coronary syndrome or ACS? There are a lot of underlying diseases that finally leading to ACS. So we have to cut all the causes for CADs. So the scope of homeopathy we in CAD we have to think another way. We're not going to deal with any acute myocardial infarction. That would be very dangerous because once the coronary artery is blocked, we have zero things to do there because it's a very acute, hyperacute emergency. We need all the equipment and gadgets to deal with that situation. Sometimes within an hour, according to international standards, we have to have the patient in the coronary artery table within an hour to do the intervention. If there is no facility to do intervention within an hour, we have to do thrombolizing. Otherwise, the patient will die or with a serious myocardial damage and pump failure. So that's why it is not possible in homeopathy. But there are many causes that leads to ACS. Dyslipidemia is one of the major causes. Hypertension, though hypertension is not a direct cause for heart attack, like it's hypertension, heart is not the primary target in hypertension, but still we have to control hypertension, we have to control obesity, we have to control dyslipidemia, and of course we have to treat homeopathically with constitutional remedies and stuff. And finally, we have to prevent NACS, acute coronary syndrome. But even if you have a patient with acute coronary syndrome, there are many options to prevent a second heart attack. That's the preventive cardiology. All right. So whenever you have a patient with a heart attack, the goal of homeopathy treatment is not to reverse a plaque in the coronary blood vessel. Every time, if you are practicing homeopathy, patients will ask you the same question. Hey, could you please dissolve the plaques in my arteries? Because my scan report or my angiogram report says that I have 70% occlusion in my artery or 60% occlusion in my artery. Are you able to dissolve it? But we should remember that removing a plaque from a coronary artery is not the goal of homeopathic treatment. The goal of treatment is to prevent a heart attack. So we have to clearly convince and clearly communicate with the patient, and we have to tell them concretely that this is the goal of treatment. So in coronary heart disease, our goal of treatment is to prevent a heart attack and control the factors that leading to a heart attack. Basically, control the markers for heart attack within normal limit.
That's something very eye-opening because, as I've told you, that we homeopaths, we don't, we are not ready to accept our limitations.
Yeah.
Yeah. Okay. My next question is, we have spoke about the coronary heart diseases.
Yeah.
What are the conditions apart from CHD where homeopathy works well in cardiology, according to you?
I would say one of the major area that we can work on is the arrhythmias of heart, like the rhythm issues of the heart. That's the most neglected area in homeopathy that we have. But the issue, there is a challenge in treating the arrhythmias of heart. We have to have a decent knowledge on ECGs or EKGs or whatever. In Canada, it is EKG, and in India, it is ECG. It's a yeah. So we should have a decent knowledge in ECG. Otherwise, we can't do anything with it. Just symptomatically, you cannot prove that we treated that condition. So those arrhythmia is one of the area that we can definitely work on. And pediatric cardiology, we have some areas we can. And don't forget that obesity is a cardiological condition. We think that obesity is that something that we have to treat to prevent coronary heart disease. Obesity should be included in cardiology. And rheumatic heart diseases, it's getting lower in number. So it is an area that we can work, but the cases are now going down in overall in Canada. I don't know much about the Indian statistics, but it is going down. And other areas, I would say, like dyslipidemia, then hypertension, then valvular heart diseases. We have a limited areas that we can work, but there are some areas. But I would strongly say arrhythmias of heart is one of the areas that we can work.
We'll take up some questions from the audience, then I'll come to my question. We have a question. Is there any treatment of dissolving a fungus over bicuspid wall?
I would say no. It's hard to do that. The mitral valve fungus infections it is very extremely hard to treat with. Systemic antifungals would be one of the major treatment for that. So it's a very stubborn case. So I usually do not touch that cases because systemic antifungals are very much needed in that case. And sometimes there will be spontaneously and sometimes homeopathy will be some maybe presenting cases that I prescribe like Sorinum 1M or like sulfur 10M, and with one single dose it's gone. But there are some spontaneous recovery in some cases. We cannot guarantee a cure for that.
Okay, there's a question. Can we do CME courses in cardiovascular medicine for updating knowledge?
From last year onwards, the FH cardiology is open for the homeopathic fellowship in homeopathic cardiology is open for internationally. So that now is able to learn virtually, and after virtual completion of the course, if you want to do the convocation and other practicals in Canada, there is an opportunity. You have to fly to Canada and do it, but on your expense. And the college is not going to give you anything for your visa process. just an invitation, then the other things you have to process. It's not something to step into Canada by like a student visa or anything. It's basically an international course that you could start, you could learn from virtually. Then it's not mandatory to come to Canada to take the convocation and practicals. If you don't want, you can do it. You can just do the virtual course 100%. And I think the next intake will be on January 2022. And usually there are two intakes, one in January and one in September intake. But September intake, I don't think you could join now because it's already done. I don't think their spots available now. But January 2022, you can do it. You can go to North American College of Homeopathy Canada's website, and there are some there is an Indian girl can help you with. She is one of the she's working in the office, and I think her information will be there when you go on to their website. She's gonna help you in in the process.
The next question is, any medicine for atherosclerosis in coronary arteries due to diabetes?
Yeah, there is nothing like coronary artery atherosclerosis is that's what a CAD means. Coronary artery disease. Coronary artery disease is majority of the cases the atherosclerosis or the plaque forming in the coronary arteries. And we don't need to mention diabetes there because the diabetes is unrelated, but diabetes can accelerate it. That's it. So if there is a diabetes, we have to control the diabetes separately and focus on the coronary artery disease thing. So as of now, if there's that's what I told you the first point. We're not focusing on the coronary artery plaque, but we could prevent the second heart attack by controlling the other parameters like cholesterol and hypertension, those kind of things. And we have blood thinners in homeopathy that we could use to prevent acute coronary syndrome. Like ginkgo biloba is one of the major medicines because it has a platelet activation factor inhibitor. PAF inhibitor is there in ginkgo biloba. So ginkgo biloba is one of the key remedy in preventing coronary artery disease, especially there's a plaque. And the other medicines are amyl nitrosum we could use for. But amyl nitrosum typically is a kind of coronary artery dilator. So amyl nitrosum is typically prescribed when there is a previous history of heart attack. If there is no previous history of heart attack, it's not typically indicated. So you could start with I would say the best remedy is ginkgo biloba. You just go ahead with the ginkgo biloba. And like I said, when there is a plaque, don't touch the plaque. Like it's not the target of the treatment. So that's the major conceptual change that we have to make in our mind. So if you had a coronary artery disease, do not guarantee that I'm going to dissolve the plaque. And again, if it is a vulnerable plaque, it's dangerous. A vulnerable plaque, if you do any manipulation in the vulnerable plaque outside the hospital, that can trigger heart attack. So if you say like I'm going to dissolve the plaque, it's basically a dangerous statement. We don't need to make any statement like that. Our goal of treatment is to prevent. What's the end result of this? Heart attack. So that's what we are targeting. And if a patient has 70% occlusion of the coronary artery, he can still go to Olympics as an athlete because we need only 30% blood supply for almost like 70% of the coronary artery flow is a reserve. So that's why if the block is less than 70%, there's no need to do anything there. If you do randomly do angiography to patients, you're going to see like 40%, 30% occlusion in hundreds of people. They are still actively living. They do not know that they have a plaque.
Okay. There's a question, is there any treatment in stenosis, like aortic valve stenosis or mitral valve stenosis? Any scope of homeopathy?
No. Valve stenosis, the scope of homeopathy is we have to, we are not going to repair any valve. It is a mechanical issue. But sometimes if the valve, you may get a patient with an irreparable valve because there is a calcification on the valve. In that case, a surgeon is not able to do anything there. That's an area that you will be getting patients. You may get, if you get a patient with the valvular diseases, which is repairable, and the patient is willing to repair it, don't touch it. But if you have a patient with the valvular heart diseases, but the patient is not willing to repair it because of some reason, he or she is scared to do it, or due to other reasons, some other reasons they are not doing it, or the patient is not fit for anesthesia, so he or she is not able to do the surgery. In that case, take it. In that case, the goal of treatment is to improve cardiac functions and to prevent the side effects of the low pumping of the heart. For example, if a patient with the aortic stenosis, the patient may get less oxygenation on the extremities. There is low oxygen saturation sometimes. So aortic stenosis is the one single condition where you get peripheral stenosis, peripheral cyanosis in cardiology. Basically, it is central cyanosis. In that case, you have to improve the hemoglobin. You have to improve the pumping capacity by giving medicines like Crataegus, because Crataegus is one of the medicines that can improve the myocardial contractility. Giving Crataegus, and you have other medicines like Ivoris that works on the myocardium. Those are the medicines that you can use there. And sometimes the patient may have calcified valves, and the patient is not able to go for a surgery because of that. Then as a homeopath, we could improve the cardiac functions by prescribing those kind of medicines. But if a patient get an aortic stenosis and the patient is fit for surgery, and if you keep that patient, there is a danger. The issue is sometimes over a period of time, the patient will become unfit for surgery. That means there could be calcification on the valves. Then the patient becomes unfit. So we actually spoil all the fit window without doing nothing there. We are prescribing and medicines, and probably the patient has symptomatic improvement. And at some point, after like 10 or 15 years, the patient got calcifications on the valves, and the patient's condition became worse. And the surgeon will check and say that, sorry, we can't do any surgery here because the valves, we already wasted all the time. So don't put the patient in that spot, right?
Okay. So there's a question, is there any course in India after BHMS to improve cardiology?
There may be, you could, but what I have seen that if you go for any courses, majority of the courses they immediately flip from the cardiology to mental symptoms. That's a problem. We will join a cardiology course. This it sounds like cardiology, but in the very next day they goes to mental symptoms and Metria Medica and blah 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 like that. No point. From my understanding, there is nothing there. Like most of the courses, if you look into the curriculum, if you go to the syllabus and discuss with them, do you teach a real cardiology here? Do you teach individual cases, diagnosis, EKGs, ECGs, and from there, and do you have anything from? Another thing that do you have any way to use the investigation techniques or the lab results in incorporating a homeopathic prescription? If you have, do you have anything like that? Then we are good to join that. But basically, I think in the North American college, they were trying to um, tie up with some of the colleges in India so that we could deliver courses there through their facilities, so that the colleges could use their facilities to do the clinicals and training there. And yeah, that would be great if and there is one college with in India, like in the in Kanyakumari, the district in South India. They have a decent intensive coronary care unit in homeopathy college. I don't know how much they are functioning now, but they set up something there and then they are working on it. So I used to go there like every year to do some clinical classes. But the last year was the only year I didn't go because of the COVID.
COVID. Okay, there's a next question. Which medicine should we give in a sudden cardiac pain without any investigation? And we don't have time to individualize the patient or investigate the
In a
patient.
sudden cardiac pain means sudden chest pain, like acute myocardial infarction.
Chest,
In acute myocardial infarction,
myocardial
you do not
infarction.
need to do anything there. There is no medicines available. Even if whatever, you don't need to, like acid hydrocyanic people are advised. Then the people, some doctors are homeopathic are advising, but I tried it, zero result. I would say the only medicine that can that you could give is amyl nitrosum because it has a kind of coronary artery dilatation effect.
Right.
And on top of that, you could give ginkgo biloba because it works like aspirin in that case. Ginkgo biloba is very slow in action. It's not going to work like an aspirin suddenly. But if you have ginkgo biloba, because it has the platelet activating factor inhibitor, you could give ginkgo biloba mother tincture, and you could give Terminalia argina to reduce the chest pain. But remember, Terminalia argina is not going to do anything for the progression of the heart attack. But relieving chest pain is a goal in acute coronary artery disease because relieving chest pain will reduce the stress and it will give a little bit rest to the pumping of the heart. So that's why if you have a Terminalia argina, you can try it. And there is no point in, and many homeopaths are using Crataegus during an acute heart attack. No point. Crataegus has no action on the coronary artery disease. Crataegus is basically acting on the myocardium. At that point, we do not need to, and Crataegus sometimes can improve the pumping. Basically, when during a heart attack, there is no point in improving the pumping. That can be dangerous. So don't try Crataegus, don't try Adonis, don't try any of those because they have real physiological action on the heart. But you could try amyl nitrosum because that's a coronary artery dilator, like 6Z potency or like a lower potency. Then you could try ginkgo biloba tincture to improve the blood flow and prevent blood clotting. And if you have, but in Canada, anybody is allowed to give aspirin in that case. I don't know the regulations in India, but here aspirin is everybody can give an aspirin right away if they suspect. And even if they have an aspirin allergy, it is not considered in a heart attack because that's kind of life-saving. I don't know the regulation in India whether a layman.
We are also
Okay,
allowed.
sorry.
We are
Oh,
also
okay,
allowed
okay.
to give.
Then aspirin
Yeah,
is don't hesitate to give aspirin.
yeah,
Don't think that I'm a homeopath,
yeah.
I'm not going to give aspirin, something like that. If you are allowed to
Yeah.
give it,
In my studies, I have done, EMS. They have asked us not to give ecosprin, but give the disprin or
okay,
aspirin
yeah. Whatever
immediately.
the regulation says, you try it.
No, no, we can
Yeah,
give.
then then
We can
then
give. It is
then
not
if you
compulsory.
have access to aspirin, immediately give it. Don't hesitate or don't think that I'm a homeopath, so it is an allopathy medicine. Also, it is a life-saving medicine.
There's a next question. Any remedy for VSD in newborn baby?
VSD. Oh
In
yeah,
newborn.
yeah, that's a good question. We have to assess the condition of the baby. If it is there is no like severe shunt reversal or like cyanotic things, just a VSD. In a VSD, we can wait a lot. And if the pediatrician and the pediatric cardiologist is telling that yeah we could wait for the closure of the VSD, then definitely we could wait and we could start treatment right away. So in a VSD, the goal of treatment is to prevent the infective endocarditis. That's the goal of the treatment. So VSD is something that naturally closes. I used to prescribe Barita carb because Barita carb has some indications in that case. Then you could prescribe even for preventing the bacterial infections. You can Echinacea purpura is a medicine that you can keep on giving to the patient. And some of the homeopaths are prescribing tuberculinum, and on the basis that it can prevent infections. Like, so basically, in that case, we have to we have to prevent infections. So the best medicine, I would say, the Echinacea purpura. That's a kind of an infection. It can prevent bacterial infections. So you can treat the patient with proper follow-up and wait for the natural closure of the VSD. In VSD and ASDs, you could definitely wait with the same protocol. For VSD and ASD, the same protocol. Right?
Okay. We have a lot many questions of cardiology from the audience. I'm not getting chance to ask my questions. The next question is, what are the medicines for post-COVID complications for chest pain? If patient is recovered from COVID and he is complaining of chest
Yeah,
pain.
that's not cardiology actually. Post-COVID, there is a like a there is myocardial inflammation noticed in many COVID cases, but they are all self-limiting. Like non-thrombotic myocardial infarction was initially was a diagnosis given to those cases, but now they changed it. There is not, some of the heart attacks right after the COVID infections were attributed to COVID related to myocardial death, but now it is still questionable. There will be a temporary myocardial inflammation because of the COVID antigens. That's the reason some of the COVID, the Pfizer vaccines also caused myocardial inflammations because the same mechanism. Like if the vaccine is making myocardial inflammation, then the virus will also make it. So we are not noticing it. In that case, I never had any experience with any myocardial inflammation happen. They're all self-limiting. And post COVID myocardial is chest pain. You have to treat like a musculoskeletal chest pain. It's not going to be a cardiac chest pain.
Okay. Sir, we have discussed about like so many mother tinctures like ginkgo biloba, amylum nitrosum, crataegus, terminalia.
Mm-hmm.
Any other mother tinctures you want to tell us about you use in your practice in
Yeah, a
cardiology?
lot of mother tinctures. So like convalescent I use for, but it should not be given in like very in high dilution. We have to have it a little bit diluted. Not like the true mother tincture. At least you have to dilute like a 1/10 or like 1/20th. Like you have to add more alcohol or dilute it. Do not. We have to be super careful in using mother tinctures in cardiology, especially veratrum viridium. I have seen that in many homeopaths in India, they are using veratrum viridium mother tincture for treating fever in kids. It's a really cardiotoxic stuff in a mother tincture form. You could still use veratrum for AFib, atrial fibrillations, but it should be diluted. It should be in a very milder dose. Okay. So veratrum you can use, convallaria you can use, crataegus, adonis, taraxacum mother tincture is a diuretic that you could use. Then let me check in my inventory, then I can tell you. Just give me 1 minute.
Any other questions?
Yeah, passiflora mother tincture you can use, or Wolffia mother tinctures, allium sativa. Then what else is sitting there? I think Iberis we already discussed. Ginseng is another medicine that we could try. Terminalia argina, syringia, Those are all like mother tinctures that we can use. And basically, cardiology practice is very easy because we have like 12 to 15 medicines. You don't need to like, everything is in like 10, 15 medicines. We don't need like, if you have like 15 mother tinctures, you could do it. You could do it. Well, so yeah, that's it. That's the beauty of specialization. But usually, what happens in homeopathy that we don't agree that we say that okay, that all the medicines are you can be used for all the conditions, and all the conditions any medicine. No, that you have to like we have to make it in a compartment. Otherwise, it's not going to work, right?
So there's a question: which mother tincture uh, can be used for coronary thrombosis?
Coronary artery diseases. Yeah, so coronary. That's what we already discussed about the ginkgo biloba is the major one. Ginkgo biloba mother tincture is it's an aspirin analog, so that's the best one.
So which one? I mean,
Ginkgo biloba,
gin
ginkgo biloba.
ginkgo
Yeah.
biloba. Yeah. So I have a last question.
Mhm.
So my last question is, what is the use of modern cardiological investigations in homeopathic prescription?
Yeah, that's a good question. We do not use much of the things in now. For example, if you look into the ECG, and if the patient has like a sinus tachycardia, you have then you could try thyroidinum, Naja, and those medicines for to control the accelerated heart rate, and you could even use Spongia for sick sinus syndrome. So if you do not know how to check the EKG, then you can. It's hard to find the sick sinus syndrome. So, for example, whenever you check the echocardiogram of a patient, and if the ejection fraction is low, that's an absolute indication to prescribe Crataegus, because Crataegus can increase the pumping of the heart. And rheumatic heart diseases, then you can, once it is you have a tissue diagnosis of rheumatic heart diseases, then you could prescribe Naja, Calmia, those kind of medicines. And if it is a dyslipidemia, if you have blood report like a dyslipidemia, then you could have specific medicines like curcuma, strophanthus, and those kind of medicines there. Palpitations, and if you see EKGs with palpitations, and you see EKGs with uh, EKG changes like ectopics and stuff, and you will be able to prescribe aurum metallicum. You are able to prescribe iodine. You're able to prescribe convaluria in that case. If it is an AFib, you can prescribe ratrum meridium. So that's why all the investigations will help you in that way. So there is always a question of individualization versus stereotype clinical settings. Mostly, you're seeing a stereotype clinical setting in all the cases. For example, I could tell you, not in the cardiology, if you sit down in your OP, and if you see a patient in the morning, typically a woman comes with a baby and tell you like, oh, what happened to your baby? Like sneezing and running nose. Any cough? Yeah, mild cough. Any temperature? No, no temperature. Like mild cough, sneezing for 2 days. Then kind of sore throat. He's not eating well. Even if you ask tons of questions, you're not going to get anything outside of that. So that's the stereotype clinical setting. So if you know how to deal with those clinical settings and what's the diagnosis behind it, it's very super easy to practice. But if you keep on asking questions to get a single point that you could get an uncommon symptom in that case, that prescription will be wrong. Because um, if you think about common things, you'll be commonly correct. If you think about uncommon things, you'll be uncommonly correct. So don't go for like too much questioning, but go with the stereotype clinical settings and prescribe right away. You're done.
That's wow. Literally, literally made my confidence so high.
Thank you.
Sir, there's one question. They want to ask which remedy you told about arrhythmias.
Yeah, arrhythmia, there are many medicines like convaluria, veratrumvirdim, then iodum, aurum metallicum. Those are the major ones. Thyroidinum, naja. Then sometimes you could use viscum album sometimes in some cases. Those are the major remedies.
Okay. There's a question. What is the treatment for deep vein thrombosis?
DVTs? Yeah, DVT cases, there is no specific treatment from my, because DVT is it's not 100% in cardiology. We do not, I don't have much experience with the DVTs. Sorry for that.
Okay, so here we'll end the session. Thank you
You're welcome.
so much. You have said, imagine I cannot do that, waking up looking fresh 2:30 in the morning, sacrificing my sleep.
That's okay, no problem.
Thank you
Yeah, that's
so much,
okay.
sir. Thank you so
You're
much,
very
sir.
welcome.
Against all the odds, you're here, and it was amazing and lovely session. We'll definitely give you the feedbacks, what we have learned, and what we are going to change in our practice.
Yeah, so
Henceforth,
I apologize
thank
for the
you.
technical glitches in the beginning session, because I'm not a big social media fan, or so that's why whenever you told me that email me, I don't have time to email. So if you call me for 2 minutes, then we can do it. So emailing, texting, and those kind of things. And a lot of people try to connect with me through Instagram. Sorry, I'm not because of anything. I'm sometimes not replying because I'm basically not a social media person, and I have a my schedules are very tight sometimes, so I cannot answer all those questions. But if there's any sessions like this, probably we could connect through this. But individually answering all those becomes is challenging for me. That's why I'm not doing. It's not because of anything. I'm not like I don't appreciate myself as a big man or big person, but my time constraints and the day and night difference between Canada and India, those are the
Yes.
challenges. And most of the time I'll be sleeping. In the morning when I see most of the messages I don't, and many patients, many people send me text messages about asking about other courses and like whether we should take a course in International Academy in there or some other course or there. I don't have any um, idea about those courses and what they do there. But generally, I would say, do not listen to most of the idea sellers. In homeopathy, there are a lot of idea sellers out there. First, you have to go and check, do they practice? That's the first question you have to ask. If somebody is like selling books, first question, do they practice? Do they do patients there? Or just book writer? Most of the books are from the laptop. They never see a patient. So that's my general advice. Always do research about them, and if they practice, yes, they have something to give you. Otherwise, these are all like stories, inflated stories, right?
Very true. Very true. Thank you
You're
so much,
welcome.
sir. Thank you so much. I'm so much overwhelmed with the session we had and such an eye opener.
Thank you very much, and
I'm
very
glad you
thank
were
you
here.
for giving me an opportunity to connect with you guys. Okay, thank you.
Thank you
Take
so
care.
much, sir.
Thank you.
Definitely we'll look
Oh
forward
yeah.
to talk more about hypertension, obesity, and
Okay,
hyperlipidemia
thank you
with
very
you.
much. Thank you. Bye bye.
Thank
Thank
you
you.
so much, sir. We'll be back next Sunday with the next
Okay, thank
episode.
you.
Till
Thank
then,
you.
stay
Take care.
fit,
Bye bye.
stay healthy.